Welcome to Functional Roots, where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, and naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque and into the powerful connections between oral health, the body, and the way we live.
So whether you're a fellow dental professional, a wellness enthusiast, or someone just curious about taking a more natural approach to your health, you are in the right place.
So grab your favorite herbal tea, settle in, and let's get to the root of it all.
All right. So we are super excited today to be welcoming Dr. Brian Edwards.
Thank you so much for having me.
So Dr. Edwards is passionate about delivering the highest quality oral health care, always putting patients' best interest first. After earning his degree in biological sciences, cum laude, from the University of the Pacific, he spent 6 months backpacking through Western Europe, New Zealand, and Australia. We will definitely talk about those things. Gaining a global perspective that shaped his people-first approach to dentistry. He went on to graduate from the University of the Pacific School of Dentistry with multiple clinical excellence awards. After years of practicing in Orange County, Woodland Hills, and Pasadena, Dr. Edwards returned to his hometown of Santa Clarita, where he lives with his wife Ashley, his high school sweetheart, and their 4 boys. Today, Dr. Edwards is leading a new movement in dentistry through 323, a model built on kindness, prevention, and transparency. The name reflects the goal of ideal gum health, 323 being the healthiest periodontal measurement, by creating an environment where top-tier hygienists and elite dentists can thrive. 323 redefines the patient experience with excellence in care, innovation, and authentic connection. His vision is to set new standards for dentistry nationwide. Uncompromising quality, personalized care, and relationships that last a lifetime. Let's get talking.
All right. Thank you.
Yay. Congratulations. That's super cool. I think that's awesome to hear hygiene forward with prevention. So this is going to be a really fun conversation, especially in some of the political stuff that's going on in hygiene right now. So we appreciate dentists like yourself who are super supportive of the hygiene model and the importance of dental hygiene. And you can tell that just with the 323 model. So exciting to have you on the show.
Thank you. I appreciate it.
All right, let's dive in. So the model, of course, 323, very clever. I think
Thank
it's
you.
very, I don't say niche specific to dentistry, but we obviously get what you're talking about.
Yeah.
Tying it into the ideal periodontal health model, but you're putting prevention first and hygiene first. Share your experiences and like what kind of got you to this place clinically, because you've shared online a lot of your clinical background and your story of being a business owner and some of the trials that you've gone through. So what has culminated for you to get to this place?
Yeah. I think it all started when I was a kid and I hated going to the dentist. And I really was not wanting to go. I couldn't eat afterwards with fluoride. And they always told me I was doing a terrible job. I needed to floss more. And it became like I felt beat down every time I went. And I felt, man, I'm trying everything I can. So having that perspective of knowing what it's like to not go to the dentist, and then realizing that working close to home, being creative and helping people, this may be a kind of a route that maybe suits me very well. And so I went to University of Pacific, played volleyball, and learned about their incredible dental school and ended up going there. And it really changed my perspective of what the dentists and hygienists are actually trying to achieve. And my mission has always been, how do I get that patient to see what the value that we're providing from their eyes? Then you compound that with now trying to enter private practice and run a business and all these other components that sometimes get lost at what the dentist is actually trying to balance and so many hats they wear. The first practice I rented rooms from, the dentist was actually taking my DEA to prescribe drugs and then ended up robbing 7 banks. So then I got slapped with the reality of, oh my gosh, not only am I trying to balance getting marketing out and all this, but now you got to balance out what's happening all around you and just trying to treat people the right way instead of just trying to make it all about your dental skills, which is originally what you think in dental school. It's all about my margins and how pretty the restoration looks. So when I bought my actual first practice after that, I had a hygienist here and we saw eye to eye on this whole concept. I had previously had some training through JP Institute. That was my first light bulb that went off on nutrition and oral systemic health and the ability and the power when you're seeing bleeding points. What does that mean in terms of the host response? And all of a sudden I was like, oh my God, like these are the answers to everything that I see clinically, but I just didn't know how to understand it or how to explain what we can do about it. And so we've always prided ourselves on looking at the whole individual. So our original practice name was 360 Dentistry. That idea of the person as a whole instead of just their teeth or in just their gums. And also too was the practice that I job shadowed when I was an undergrad. So it's like this back to the starting point for me. And then really developing this over time became a strain of, okay, now I'm growing the business. I added an associate. I expanded to the suite next door, added 3 more operatories, and we're getting busier. And then all of a sudden it's like, if the insurance company is going to pay me less than what I'm paying the hygienist per hour, how am I using the hygienist as something that I'm advocating and I'm excited for? And how do I introduce more technology with, now we're doing the GBT, the oral cancer screening, saliva testing, probiotics, what the hygienists are able to do. And obviously what this podcast is all about is you have so much science and research at your fingertips. How does the practice owner allow them to thrive, but yet still run a business? And I've struggled with that for so many years. And that's really my purpose of getting my message out there, is that it's our self-limiting beliefs as dentists of what we're going to have happen if we do drop insurance contracts and start charging for the value of what these hygienists are bringing. And it wasn't until I shared my vision with my team and got them behind me that they actually were believing it and encouraging me more that, hey, doc, we can do this. We have a whole team here that's doing great care, and we deserve to be reaching those numbers and making it where it's successful for the practice as well as the providers to be doing the great care that they're trying to give. So when I stepped out of the way and stopped being the bottleneck of the practice, some of those insecurities had to be let go to say, you know what, oh my God, if I just let the hygienists be as best as they can, create the ideal day, we're doing 7 patients an hour each, but they get paid an 8-hour day. So they have time to do the team huddle in the morning. They get 15 minutes to do notes and cleanup before the end of the day, and then 15 minutes at the end of the day. So they're here from 8 to 5 exactly, get home to their family and have a great day. I think we forget so much of how much these hygienists spend their days and hours, and it's an exhausting role. And especially if you're overwhelmed with no support, it can be such a challenging job. And then how are you supposed to provide the best care when you have all these things going against you? So I think recognizing what information you're putting out there, but then how do you create an office environment where these hygienists can apply it to their patient care, where they've got life behind them and they're really genuine about teaching OHI and they really care to connect with patients. If you can make that difference of 6 months was what you have done, but we haven't got good results, how do we now change your pattern so that we can actually achieve health? I hope that wasn't too much right off the bat.
Yeah, no, it's awesome.
Louder for those in the back.
Yeah. Ah! I love it. I think it's like that 360. You have the 323, but also it's full circle, 360 degrees for that. I think hygienists, when we are able to practice the way that we truly want to practice and look at the oral systemic connection and the whole health of our patients, it is far more productive for the office because we are adding in adjuncts, and when we have time to do that, and we're not just trying to get through a tooth scraping and really looking at root cause and solving problems. One, it helps with the relationship with the patient. The patients understand that we care about them. We want to get them better, but awesome that you're supporting your hygienists and giving them the technology to help with that process, because without having that expense in the office, I think it's hard for us to really take hold. So it's really nice that you're supporting your staff.
If we leave the ego at the door, we understand that this relationship between the hygienist and patient is actually stronger than the patient relationship with the doctor. So like that idea of like continual care where they know there's no surprises, they know they're not going to get hurt, they know that they have trust, someone's holding them accountable, then people want to come back. So instead of this model of like, how many new patients are you getting per month? How many patients are leaving out the back door, never coming back? Right? So this whole concept of like, why do you work so hard to get new patients if you're not going to do a great job once they're in the door? And so this whole thought of this seems like such simple people skills, but it's also too, I'm born and raised in the area that I practice, and this is a representation of my pride and also what I can do for my friends and family. And if I want that for myself, then I feel like other people should have access to that as well. So it's been a really cool thing to step back, and then all of a sudden trying to find now 12 employees that get along together, that want to sit together at the table, want to laugh at lunch, want to work together and hit goals. The camaraderie between the team, now that the hygienists are respected and are thriving, the whole team now respects what they're doing because they're also trained on all these skills, GBT, oral systemic connection, and they really appreciate that just a 20-minute cleaning is not actually effective. So I think when everyone's on the same page and they feel empowered, then it's really incredible to see what happiness around the office occurs. I've had many years where people aren't getting along, there's bickering, and it's really frustrating when everyone's just trying to do their best job. But I think the limiting factors of these stresses we put on the hygienists, they have no other way but to feel tension and to feel unsupported. And then all of a sudden they're working against the team instead of with the team. So what I've done, I've actually worked in an office where there was 4 hygienists, and it was such a busy practice that I started understanding and listening from the back end as to what their challenges were. And part of it is you have an hour and you have medical history, oral cancer screening, doctor exams, questions, x-rays, charting, not to mention actually getting all the things you want to do clinically. So what we were doing here was actually having 3 rooms for 2 hygienists. And so that way we have a dedicated assistant that is running those 3 rooms constantly between seeing the next patient early to take x-rays, being available for clinical notes, charting, grabbing any instrument that drops on the ground, whatever it may be, that way the hygienist can keep working full attention on the patient and there's someone there supporting them. And so if you talk to any practice advisor, they're going to say, you're an idiot. Do you know how much money you're losing by not having that room packed? Do you know how much money you're losing by having an assistant for hygienists? But I guarantee you put any of those providers in that chair to clinically work, or you have a doctor say you can't have your assistant for the day, they're going to feel lost. I can't be as productive in my dentistry if I don't have my assistant. I feel the same way if you're trying to do hygiene. If you don't have someone readily available to help you out, then all of a sudden they're not as effective as they can be.
Yeah, a perio charting can take 15 minutes if you have to go back and forth and you're doing furcation and bleeding and suburation and recession when we have an assistant there to help us with that. Amanda, you follow a similar flow with that, right? You have an assistant that helps you.
I do. I do double hygiene and I have a dedicated assistant, and my schedule recently changed and I work a single column twice a month, and oh my gosh, I hate a single column anymore. And that's what I've worked for the vast majority of my career is single hygiene. And double hygiene, I am less exhausted because I'm doing the things that I love and that fill my cup as a hygienist and as a provider. I'm not polishing. I hate polishing. I don't have the luxury of GBT like your hygienists.
Come on over. It's a game changer.
Yeah, it's amazing.
Well,
but I used to be in an office where they literally had a timer for doctor exams, and they'd flip it. And if you hit your 5-minute mark, they would cut you out because they got to get on to the next one. And there's some point of this where you're in the hygiene visit and this patient is starting to click and understand what's going on, or maybe their sleep and airway issues or the itero scan is now talking about the reason why they're developing some of these periodontal diseases. And you're at that point where like, this is the most important part to be connecting with the patient. Please don't cut me off just to see the next patient. And so having that flexibility with either the doctor or even the hygienist explaining more, hey, her post-op instructions, to not feel that rush of, oh my God, my next patient's here, get you in and out the door to clean my room. Let me finish this most important part of the appointment without feeling that. And that's for me where we make up that value in terms of the empty chair. It's the value you're getting with the quality and not the quantity that's coming through there. And I think that's where patients really, in terms of their expectations, is they're treated like a person and they're not treated like a number anymore. And they know the hygienist by name. And then all of a sudden, this is different. Why are the prices like this? And we basically say it's because we want you to have the best care and we're not willing to compromise that just to get you in and out the door. And it's a really hard thing to have that confidence as an owner doctor saying, I'm going to stand up for my team and what I believe in, more so than the fear of the practice going under because of the insurance no longer being contracted. It's scary as hell. And that's the part where I feel like if I just keep this to myself of the journey I've been through, then I'm being selfish and not sharing that with other doctors that know they need to do it, but they don't really have the confidence or that push to get there. And I think now seeing it on the other side, I couldn't even imagine practicing without this because it's so hard to feel like I want to give the best, but yet it's costing me money just to have the patient in the chair.
So your fee for service?
Correct. As of a year ago. And then California, we had a collections agency said that because of the laws being passed in California, they're no longer going to be being of service to us because they can no longer chase anyone with medical or dental bills. It hadn't got passed yet, but it was in the works. So they basically just told us to write off our accounts receivable and that we can't use them anymore. So we had this now hurdle of not only going out of network, but now you have to pay it full time of service. And as an owner, you get so scared that these patients are going to hate you or get mad at you for putting them in that situation. So the really cool part of the solution that I came up with was I make my SBTs and my Profies the exact same fee. I make my FMX and my Bite Wings the same fee. I make my exams, new patient or periodic, the exact same fee. So what I know is the new patient exam, x-ray cleaning, and their recalls are going to be the same fee. So there's no really big fee and then a really small fee. And that allows us to predict if you're more at high risk, you come every 2 months, you're going to be paying more per year. But if you're on a every 6 month plan, you're paying less per year, not because you're more maintained. It's just because of the fact you don't need as much help. And what that allows me to do is say, I know exactly what your fee is going to be for the year. Here's what it looks like on a monthly basis. So now we're rolling this VIP program where it's like, if you prepay, auto pay on your credit card, your monthly expense, whenever you come in for prevention, you've already paid for it. And then you get 10% off your additional services, because what I found is people are okay with that monthly amount, but if they're paying X amount twice a year, it seems so overwhelming. And then to wait 2 weeks for the insurance check, how are they going to live like that, especially if they have multiple people in their family? But then all of a sudden, if you look at, hey, per month, it's not that bad. And all of a sudden, if it's automatically something they can budget and plan for, it's definitely palpable and it feels more something that they can do. And all of a sudden, we're finding patients that want the care that couldn't necessarily find how that works financially. Then all of a sudden, when you actually draw it on paper, they realize, oh my God, maybe I should even drop my insurance, because if I just do this prevention, I have no problems, my fees are going down. And the more people are coming in, I tell them, the better news you're going to get. The more you stay away, the more big problems and discussions we have. You know, for implants to be thousands and thousands of dollars, what if we actually were preventative, found the bleeding point sooner, got you on prevention, and avoided the extraction, avoided gum surgery? That's the whole concept of 323. Is I know it's not ideal for every patient to have no bleeding points, but if we set our standards that we expect to get a level of health that's maintainable, we should be striving to do anything we can to get there. And so that's where we're trying to set our standards and our expectations different than just accepting what's been status quo.
I like that model, especially if you think about the expense of insurance in general. And now that we've discussed a little bit of how your model is, but just paying for dental insurance, you have a monthly fee already that you're paying. But the insurance company is only going to give you $1,000, maybe if you're lucky and you have a really great insurance, it's like $1,500.
Yeah.
So you're paying X amount and you're only going to get this much out of it. And that's all they're going to help you with. So it's really a discount plan anyways that you're paying for. So you're already paying that out of pocket. So if you're doing it privately with an office who's excelling in prevention, it makes sense that we would just pay for it out of pocket, have a monthly. I wish my biologic practice had this option for, they want it all up front at the start. Man, I would totally pay for a monthly fee. This is and you can come in and do your maintenance and based on the health of your mouth. I think that's really cool.
Yeah, thank you. I know it's a totally different concept, and I know some people feel like for my periodontal maintenance, I'm working a little harder than my pro fees. And my point is, how many discussions have you had with spouses of, okay, you went through your scaling and root planning, but now your fee's going to be more than your spouse. Then why are you charging me more and not? And then it becomes a really hard thing to discussion with patients. And my thing is that if you're more at risk with your health factors or your previous bone loss, you need to be coming in more often. So your expenses are going up because you're having more visits, not because of your hours going to be any different, even though it is clinically. I want them to understand from their end of it, because a normal person wouldn't necessarily see the value in that all of our fees were raised up to be pro fee and that. But to be honest with you, some of the patients that are in 6-month pro fee are actually sometimes more challenging than some of your well-maintained post-scale and root plane patients. True. And I found that a really hard thing to understand in my mind of like, why are we not making things all about, it's the hygienists, it's their time, it's their materials. This is all of value that they have to be producing 3.3 times their pay. So that's what our goal is in terms of trying to hit targets of, you're getting paid this. How do we reach numbers where you're not being seen as a deficit to the practice, but almost like you're carrying this practice. 1/3 of our whole practice is on your shoulders. And not only that, but you guys are doing such great care. People want to come back. How do you not want to build a practice based off of these incredible people?
I think you have said it all here. And there's so much. You have done such a great job of creating your hygienist and empowering your hygienist. And there's so much impact that I feel like insurance is really getting their hands in so many things, and it's driving the division between the team that we should be in dentistry as hygienists and as dentists.
100%.
And I think you've taken that third person out of the picture, and you're just focusing on the care that patients need. And that's what it should be about. It shouldn't be about what does my insurance cover, because that's We know that's 99% of patients, no matter where you live, if they have dental insurance, that's 100% one of the first questions they're going to ask is, okay,
Yep.
but my insurance covers this. And so you've taken that out of the equation and it's like, this is about your health. And we want your prevention to matter more than anything that your insurance can really bring to the table, because we know that's pretty minimal anyway.
I know it sounds silly, but I use the analogy of like patients saying, are you just being greedy by not taking my insurance? And I said, absolutely not. I said, imagine this. You're going to want to put your pride and joy of everything you've learned over the last 20 years of your life. You're going to open up a pizza shop. Do you choose to go on Groupon and sell $5 pizzas and try to get 1,000 people in the door? Or are you saying, I'm going to put my pride and joy into find the best ingredients, the best materials, the nicest hostess. So when you come in, you really feel my love towards you of what I want to create for you. And that's really where I say, don't filter your dentist on the search engines by, do you take my insurance? Filter it by what kind of quality you're getting. How long do you have to wait to get an appointment, or how long do they make you wait once you're in the office? And that's the really big part of like when we literally slow the day down and do it right, your time of overhead is ticking as you're sitting there spending time with one person. So you have to make that practice decision. Are we going to do volume, or are we going to do more quality based and slow things down? And I found I'm 15 years into practice, and it's really easy to burn out going spinning wheels left and right. And how many things are missed when you're not actually having time and energy to do the right things? So that's the part of, if we're going to take pride in this, making sure how was your vacation that you got back from? But more importantly, that 6 millimeter pocket on the distal number 3, I want to check that today and see if there's any bleeding associated with it. How's your water pick technique using? Oh, it's broken. Great. By the time you leave here, let's get that ordered again. That simple little change of remind them to order a new water pick in 3 years might have been the difference between osteosurgery and not. And that's the part of what makes it so cool when these hygienists will work at different offices and they're like, doc, like I can't work in any other office because this is allowing me to practice how I want to practice. Yeah. And that's the goal, is how do I not burn someone out? How do I get them to be a happy team player? And how do I actually push them in their clinical knowledge to do things more than I've ever seen before? One of my hygienists, Brandy, has been doing oral saliva DNA testing, and I feel like she's become a primary care physician that people have no idea that she has all this knowledge and training. So when we talk about the threat of assistant scaling above the gum line, I find that for hygienists that are listening to your podcast, it's of no threat to them. Because you have this ability to train, connect, teach, learn, and give them so much more value than they're ever going to get. There is a time and a place for every patient that wants certain care, and that's okay for access to care if that's what they choose. But to have that option, if you're a hygienist that wants to provide the best care possible, there has to be environments out there that allow that and support that. Because otherwise, we're going to push them to all be independent hygienists that are going to do their own thing because they don't want to work for these offices that won't let them do what they're great at. And not that's a bad model, but there's a book called the E-Myth Revisited. And it's this model on just because you're good at something doesn't mean you should own something. And I read this book and I was like, oh my God, I wish I would have read this before I became a practicing dentist. Because I thought it's all about just doing great dentistry and the people will show up, do a great job and go home. But running a business is so challenging. And that's one of the questions you had on here for me was, what book am I reading? And that's the reason why I'm on this podcast. It's called Buy Back Your Time by Dan Martell. And I've actually joined his business mastermind group. And it's this whole concept of if we step out of the way of trying to control everything and you actually empower and put systems in place where you can hold people accountable, but let them actually do their best, it's amazing what results you'll get out of people when they can actually feel empowered. And so that's really what's trying to free up my time to not be in the chair all the time is, oh my gosh, I've got people doing certain things and all of a sudden they're happier, contributing more, and I'm not in the way anymore. It's a hard balance, but once I'm starting to realize to shut my mouth and let them do it, it's really cool to see them flourish. And I even have 2 of my hygienists that are actually on the RDH Magazine podcast because I took them to the RDH Under One Roof. And like for them to actually speak and be on the podcast is such a cool thing for me to see them actually get a platform to share some of their stories, because we all come from different backgrounds. And I think we've all been at different practices that you hate so many things about it, but you love so many things about it. And you're like, I wish I could just merge all those love things together and make this one ideal practice for me to work at. And I think my experiences of being at 10 different practices, I'm really trying to say, like, literally, we have a blank slate. We have no more insurance contracts. What does that look like? What does this look like? And actually defining it, putting it on paper, getting systems in place, and trying to reproduce it every day. So that way that 3-2-3 feeling of that patient in the chair that's like, oh my God, they're maintained. They look great. That was a good appointment. How do you get that all day long? That's
I
the
love
goal.
it. I feel like you emulate what leadership needs to look like, and we're missing
Yes.
that in so many aspects. Leadership, and that's what I really hope that Amanda and I are bringing to some of this as well. But leadership is about, I love protocols, but making sure that people are fulfilled and filling their cup, and you're leading them in that. A lot of times leadership tends to be like snuffing people down because I got to be the big guy. And I think we've all in dentistry experienced some of that. I got to be the big chief and you're just the hygienist and do your job. And I love that you're lifting your hygienists up and showing that everybody has their specialty, and we should be growing that and helping to develop each other so that our team grows in all. Providing the technology. I love that you're using salivary diagnostics. Your hygienist and I should get together. I think that there's so much that we should be doing in salivary diagnostics. I think it should be a standard of care.
Yeah. And
It's pretty spectacular. And then guided biofilm therapy. I have so many conversations. I don't know if I'm going to get the dentist to use it. What are the pros of utilizing it? The benefits to the patient and the benefits to the practitioner are so much better. Clinically, your patients are going to feel better. They're going to have a better experience with their cleaning. Your biofilm disruption and reduction of the pathology that you're doing in your salivary test is going to be improved. And our ergonomics is way better. And we're not scraping the hell out of the teeth because it's much kinder in that perspective. So I love your leadership, and we need more of this leadership in dentistry in general to grow not just dentists, because there's a lot of dentists that could learn from you, but also we need that for hygiene to be elevated in the way that it should be, because we are not in competition with the dentists. We are the providers for prevention, and we shouldn't have the goal of having to do more crowns and wanting to do more work. That's what I loved about the dentist I worked for, is he was like, you do you. I don't want to have to redo this filling again. I want it to last as long as it can. And your job and what you do makes my work last a lot longer and be successful.
it's incredible. And that's really where I started feeling like I'm an introvert. And so to see all this tension between hygienists and dentists go on, and then to finally say, you know what? March was when I first started making the Instagram account and starting to feel like, okay, you know what? Someone's got to stand up for what can we control? What can we do to make a difference instead of complaining and fighting each other? Because there's a lot of tension right now between dentists that are really trying to run a business and hygienists are saying, but I can't do what I want to do because I can do so much more. And it's a really big problem with our profession right now. And that's really where I decided, you know what? There's something that I got to do here to make an impact, because I struggled so hard to finally get to a place where I could do great dentistry at fee for service. And the answer is right in front of our faces, is the oral systemic connection with these hygienists that are so wonderful. Let them be wonderful. And no better patient that wants to do a fee-for-service crown than a person that's willing to pay for fee-for-service hygiene, right? Gone are the days of, I can no longer do a crown for a couple $100. Physically, mentally, the office, the overhead, you can't run a business that way. And so for me to find answers in doing things the right way, and realizing that we need to speak up and join these two professions, the hygiene and dentist, together and merge as one, uniting them together is going to be better for patients across the country, because they're going to get better care. They're going to get restorations lasting longer. They're going to spend less money on problems and surgeries. And that's really what my goal is, to advocate. We can do this. We have to just stop fighting each other and start finding solutions for ways it can work, instead of just saying it's not going to work because this is the problem.
And what we do in dentistry isn't just about the restorations or even bleeding gum tissue all the time. You guys are doing salivary diagnostics. So if you're doing more testing, there's a lot of people who have systemic disease pathways and may not have the susceptibility of dental decay or inflammation, that we as dental professionals are impacting systemic health, and we can prevent Alzheimer's, inflammation, rheumatoid arthritis, cardiovascular disease, stroke, pregnancy outcomes. Like, there's so many other things that the mouth is connected to, that this preventive strategy, the 3-2-3 model, is applicable, just not for the mouth, but systemic health in general.
Yeah. And this cool part of society that now with the internet and information and people wanting to take that proactive approach, I feel like the trend for society demanding that is going that direction. But I listened to your guys' podcast with Ann Rice, and I'm like, you guys are so much smarter than all of us dentists on all this stuff. Why not let them shine? Why not let them give this a platform to impact, like you said, the patients, not only their oral health, but their whole systemic health? And you see it right there on the mouth. If we just blow through every patient, you're going to miss it. If you take time and you actually connect and start seeing these patterns, all of a sudden changes you pick up on, you're like, what's going on? We've got a patient right now that she has a lot of systemic issues, and all of her specialists are blowing her off. Yeah, she's fine. Numbers look fine. And we're like, she is not fine. Clinically, she is not fine. And she's, thank God for you guys speaking up and being my advocate, because I just assume, okay, if they don't have a problem, I'm okay. And we're showing her what's happening to her body inside of her mouth, and she sees it. And it's been the coolest part of actually seeing like what information my hygienists are doing for her is greater than any other person that's done for her. And if we don't speak up for health and what our standards are, then who else will? And that's sometimes when a patient says, I'm going to come 6 months. And my point is, those obstacles and hurdles that you've had in the past that are keeping you at the 6-month mark is what's going to keep you from achieving health. And if I don't stand up for what I would do for this and myself and your health, then who else is going to speak up? No one else is looking at your gums and your teeth. This is our job to be taking care of you. And we're providers, and this is coming from our caring part, not because we feel like you need to be coming more often to make money off you, right? Our goal is to get you on a maintenance mode, and maybe we even graduate you out to even a further interval if you can maintain it with what you're doing at home. But I would hate for you to see the disease come back. And so that's the cool part about the verbal skills, the trust skills, and all of a sudden the expectations of what patients are getting. It's pretty amazing. They're like, hey, are you going to take my gum readings today? Oh, let's do this disclosing. I want to see how the plaque is looking today underneath the camera. Like, they're actually expecting it and asking us and holding us responsible. And it's a really cool thing that a lot of patients are responding really well to.
That's
So
100% patient buy-in right there.
For sure. What technologies are you using? We know you're using salivary diagnostics. You've got guided biofilm therapy. I'm assuming you've got lasers. So what other technologies are your hygienists utilizing, and what have they encouraged you to explore and help them with their oral systemic treatments of their patients?
We're also using the paraprotect trays. We're also using probiotics. The things that we're looking into that we haven't done yet would be the ozone, the desiccation, and possibly the microscopy. But
Practically biological. You just haven't like fully red pilled yet.
You and I need to, we gotta talk. Yeah.
But each of these things has been me going, hey, have you guys heard of this? And like the GPT, I said, I've heard of this really cool thing. Have you guys heard of it? They're like, yeah, I don't know. I'm like, I'm getting the rep here. Let's learn about it. And then I'm like, I'll buy one. And if you guys start fighting over it, we'll get more. But if you guys let it sit in the closet, I'm not investing more. So it's been a lot of this, like, my want to achieve like what's possible that pushes them a little bit out of their boundaries. And I think makes them a little uncomfortable for new things and changes. But that was what was so cool about the RDH Under One Roof is like, you're exposed to so much out there, and you see all these hygienists that are really wanting to learn it all and become as best clinicians as they can, and seeing all these new products and information coming out in studies. The science behind it is overwhelming of, like you're talking about, where you can take this to in salivary diagnostics. It's absolutely incredible. And that's where if you slow things down, you have more energy in your day, there's more want to learn this stuff.
With salivary diagnostics, I can tell if someone's mouth breathing just by the bacteria that's there. Mouth breathing, you can point them in the air. There's a triangle. We got to look at the triangle, and I can tell by reading the bristle test if I have an airway problem, a gut problem, and I can walk people through the bacterial species and where we need to really start focusing and get some good collaborative care involved with our patients, because it's not just the mouth. There's the airway, and there's the gut health, and the inflammation and cytokines from one direction to the other feed diseases in both directions. So it's super fun. I think salivary diagnostics is the wave of prevention in the future.
The fact that you're tying in the gut health to the mouth health is like mind-blowing to me. As I know this by science, but yet to hear it and see it in clinical practice, and then for patients and hopefully the medical field to also at some point start recognizing this.
Yeah.
And I think that's the biggest goal.
I just had someone who had a sore. He was like, oral microbiome looked pretty good. I had some stuff in the raw results section. I was like, these are tied to some gut dysbiosis and ulcerative issues. And when we have a leaky gut problem and ulcerative colitis and those types of things, we have sores in the mouth. leaky gut, leaky gums. So one clinical sign of ulcerative colitis is sores in the mouth. So when we have those signs, we have vitamin deficiencies and we have an ulcerative problem in general along the entire tube, and it's showing up in the mouth. We have to look at the whole entire picture on what we're seeing in our patients.
Yeah, that's incredible. I love it.
I think it just is so encouraging to hear you speak of just wanting to empower your hygienist, and you're seeing this, you're open to it. And that's sadly not the case for so many doctors. I work with two pretty new grads, and they're still just like head to the ground, chlorhexidine for everything. And I'm just like, what are you guys doing? What is this? What is happening here? Who's teaching you this stuff? One of the new patients that I've recently seen, she had some recession, and we talked about periodontal disease, this sort of thing, because the pattern, it was not brushing too hard. And the doctor, brand new doctor, came in. She goes, "Oh, I think you're brushing too hard. I'll have Amanda go over brushing techniques with you." And I'm like, she's brushing too hard on the palatal of number 15. Please tell me more about that. Yes, that's always a problem. Oh,
And I think that's also too something that hygienists also start realizing too, how much is on the doctor, especially a new doctor, to start understanding the complexity of the mouth, not only the gums, but also the teeth and the function and aesthetics and all these different components to it. And that's why we can't do it all ourselves. And that's why the hygienists bring you what their value of knowledge to the patient should be. And that's where I always sit down and say, all right, so how'd everything go? And the hygienist tells me, no, I agree. You're right. Because every time they just spend an hour with the patient with all their training and knowledge, they're the ones that are closest with what's happening in there. That the reason why my hygienists are thriving is because I trust that their education and their tools is giving the patients the best care. And who am I to be judging what they're recommending is the next step? And I know in terms of like legality part, I look at the gums and all that. But in terms of what would be the best treatment modality or the next interval, I trust my hygienist to tell me what's needed. And so that's where a lot of times this working together as a team and trust is so important, especially for a new grad, to let your hygienist help you with what would be best for the patient. And I think sometimes this model of I'm the dentist and I'm going to be in charge of everything for patient care is something that we also need to educate them on too, is like to empower the hygienist to be great at what they're great at and let us be great at what we're great at and meet in the middle for best patient care all together. Then we work as a team instead of fighting each other. And it takes a little bit of time to learn that and a little bit of age and understanding how that all can be best put together. But in the end, like having these examples and discussing this possibility of thriving together is what's going to allow new grads to open their eyes and realize, wow, I didn't even realize that the hygienist can be discussing gut and inflammation. What about saliva testing? I'm not sure about that. And I guarantee you it was only 5 years out of school that I started hearing about some of it, and I didn't know any of that. So some of it is just the education and the tool of getting this information out there so they're exposed to what their hygienist can do. But it's also too the tools, what can the hygienist, if you do know that and you have a new grad that's not respecting it, how do you open their eyes to this new world? From me, I think having a third party of what you guys are talking about in terms of holistic hygiene come in and educate the office, between the front office, the people answering the phones, the office manager, assistants, dentists, hygienists, so they're all on the same page. When it comes out of I found at least, a third party mouth in terms of knowledge and expertise of the value of this, everyone starts going, oh my God, you mean all of this? And they start opening their eyes to what's actually happening. Then they start saying, wow, these hygienists are doing more than what I thought they were doing. And it creates a little bit of trust, a little bit of value that they're bringing to the office beyond them telling you, look what I can do. And I don't know if any dentist is open to that, but maybe approaching it in a way like, if we hit these certain goals, here's what I've found as a great resource, whether it be a webinar or whether it be someone coming into the office that could really maybe get us all on the same page as to what I can provide to these patients. And I want you guys to all understand that. And so maybe if I hit these goals or set these metrics, could we do that as a team? And I think if you get the whole team to understand the big picture of everything you're doing, then you start getting the acceptance and the support from the team. And as soon as that happens, and all of a sudden, if you do need that extra material or the instrument to be able to do what your job is, there's a purpose and a reason why you need it. If they don't even value what you're doing and can't even see these things that are in your head of these ideas of how to treat them, they're never going to want to invest more in it. They don't even see the need for it. So I think part of it is getting the whole team educated from someone that's non-biased, that can bring in this information where they listen to it. And then they start saying, wow, oh my God, whatever it is you're doing, you got it. I got your back. And
I
that's
love
really
that.
that switch that has to happen is these doctors have to see from your eyes, not from running the practice eyes. So that's the
Right.
hardest part of GBT, right? Talking thousands and thousands of dollars,
Yeah. Yep.
but talk about a 3D milling unit, it doesn't even compare. How can we invest in a cone beam CT, but we can't invest in the hygiene instruments?
Or a photon laser that's $100,000 for restorative, but we've had to be in offices where I'm like, I need instruments. They're like, we don't have a budget for instruments. I'm like, hygiene instruments get sharpened regularly. That means the tips need replacement. That means we need to replace our instruments on occasion.
Right.
It gets to be a battle in that perspective. I love the idea of learning together. I always enjoyed the offices. For me, learning is like the ultimate reward. Like that learning for me is way better than getting a lunch.
Yeah.
And when you add lunch and a learn to it, it's even better. But like for me, a reward is we're going to take the whole team to this course. And there are some practices that are like even bringing in speakers and having those types of, but I think it's important for the whole team to go. And I love that you went to under one roof because that's usually the case. So high five for that. The IOMT, Amanda and I just went to last week, and that was most of the dentists. And there were a few hygienists there, but not the whole team. So when we bring the whole entire team to a course, everybody's on the same page. It's really, like you said, the front desk has to schedule and they have to understand how to discuss the treatments and why we're doing certain aspects. The treatment coordinator needs to understand, why did my treatment change because we did a salivary diagnostic test?
Yeah.
So she needs to understand some of the basics behind that. When I do all of the training for Bristol, I try to get the entire team on board and emphasize the whole entire team has to have the same messaging. You need to have an office meeting, practice that messaging. I know as much as role playing can be super goofy and weird sometimes, but when we have the same messaging and the whole entire team understands what the message is and the reasons why we're implementing this new technology and what it's going to bring to the office and the health of our patients, it gives everybody a chance to be a part of the team and understand the why. And when you understand the why, you get a lot more compliance for the entire team and for the patients because everybody's getting the same message.
Yeah. And this year we've also started implementing a monthly hygiene where all the hygienists come together for an hour and discuss some of these changes, materials, supplies, and even some of these challenging cases. And then having a hygiene lead that can bring it to the table with all the other leads. We're starting that this year to really understand this cadence of consistency. We always went through learning one thing, and then all of a sudden it seemed like over time it just goes to the wayside. And that's really been a huge impact for us to start keeping up on communication between the team and actually blocking off time from the schedule so that it actually happens and getting the hygienists to have time to actually discuss and talk about, hey, this certain product hasn't been working or this instruments really need to be replaced. Can we make a list of that? At least time of like when you're in the clinical chair, you don't have time to deal with all those things. And so to get them all together and to have one representative bring that to the table with the other ones has really been a great thing from a consistency standpoint. And all of a sudden we're finding that this continual discussion, things are growing in the right direction instead of feeling like, great, we put out one fire last week and now we got another one this week. And it feels a little bit more of like we have a team that's wanting to keep improving. And like you said, learning is why a lot of us got into education, is to become better and give back to people. And if we throw that out the door and only worry about getting patients in and out the door, then we're losing the whole sight of why we got into this in the first place.
I absolutely hope you are mentoring other doctors. Like everything you're saying, I'm just like, do I need to move to Santa Clarita? I feel like I do need to move to Santa Clarita.
I actually did have one of my hygienists moved across the country and she was flying back a couple times a month just to work here, which is the biggest compliment I could ever get. But I'm trying to do my best. But yeah, I do have a guide that I'm making for dentists or hygienists that want to introduce this to their dentist. If you go to Instagram 323 Dentistry and you just write in podcast, I'll send you the guide for 10 steps that I've been useful in getting me to this point. But that's my next step in terms of allowing doctors to get coaching, trying to make myself available to let them learn from the lessons I did and how did I do this and what mistakes and stuff could we prevent by actually discussing some of these problems. Or something simple as, hey, if we're going to do the GBT, what do I need to be prepared for? Or is it going to be worth the investment? And you already listed a number of things that just touched bases on just the importance of GBT, and like once your eyes go off and you see it, you can't go back.
No.
And so having that confidence that I'm making these right moves that patients want to pay for, that actually are the best care possible, and then all of a sudden the hygienists are thriving because they're excited, they're doing the right thing. The reward is not monetary. The reward is in value, and it's in appreciation and happiness. And then you just start loving what your team is doing. And it's a hard thing as an owner to get happiness.
It is. It's a
Can't buy that. You cannot buy that.
And dentists weren't taught how to run a company. There are so many dentists that maybe they have really good clinical skills, but their business skills are, you weren't taught that. It's a whole nother aspect. You like need some, so kudos for you for really thriving in your business model. And now speaking out on what can be successful. I do think that fee for service is probably the most cost-effective way for us to do what we need to. And honestly, patients are already paying insurance companies, and the insurance companies aren't providing health. So why not just pay the doctor and get the health that you deserve?
Yeah.
Health and wellness is supposed to grow in like trillions of dollars in the health and wellness space. And I think this is what dentistry is going towards, is more, I don't want to say concierge, but more get that third man out of there. I want the health that I want, and dropping that. Obviously, that's not going to be every patient, right? Like you said, like access to care. There's still going to be people that are very low income that just cannot afford more for their health. But I think a good number of people are really going to be waking up to a different standard of health, not just dentist side of things, but health in general, and looking for that integration. So I think you are setting yourself up for success in so many ways, obviously patient wise, but I have worked in a practice where the dentist literally told me, it doesn't matter what you think. And that's the most demoralizing thing. You are never going to have a problem filling an employment vacancy in your office ever.
Yeah.
And you will have people lined up waiting for you to work. And I wish this was the model, because as hygienists, most of the time, we don't get to be practice owners, right? There's very few states that we get that privilege, but it does come with such responsibility. Like Heather was saying, you're not taught that. You're not taught people management skills. You're not taught so many things. And business owners do have such a colossal weight on their shoulders. Like, you're just trying to do a good crown margin, right? That's what you're trying to focus on. And now you're having to pay this hygienist, and it's so much easier to vilify and see them as a money sucker, as we talked about in the Anne Rice podcast, instead of seeing them as a potential asset for your business and to what you can grow and the value that can be brought, not just monetarily, but just the value that they bring to a practice. That's what we want. We don't want to just collect a paycheck. Like, we definitely are there for that, but we want to bring value to the practice, especially when you, like you're saying, you get to work in the community that you live in. I thrive on that. I see my patients at the gas station, at Starbucks, wherever. That matters. Those are the people that I'm caring for. And so getting to provide that care for people and knowing that you make a difference, that drives you so much. That just absolutely is the difference.
It makes a huge difference. I think that was one of my favorite parts of clinical, is just having those patient connections, having conversations and understanding. I remember when I gave my notice, and one of the patients that I told, like, this was my last day with him, he just like, it caught me off surprise, and his chin started to quiver, and he bawled the entire visit. And then we walked up front, and he was bawling. I was giving him a hug. We were both crying. Those relationships matter. That's what makes you important to your office, when you have those connections with your patients. When your patient comes in, I don't know what you saved my life. You found thyroid cancer, and you were the first one to tell me that I needed to see the physician, and recognized it. I owe you my life for it. Like, we have such a good value.
And so fortunate to have those hygienists here. When you have those hygienists that actually want to do a great job and care and connect with people, I'm so blessed that all these hygienists that have worked here have that in them. And it's so great to see that mutual respect of what they're able to get here, and they just pass along to the patient. And I'm just so grateful that there's so many of the hygienists out there that are trying to do the same thing. And that's where right now we got to stand up and let other dentists know that it's possible to let them be great.
Yep. Awesome.
Would you like to be the president of the ADA? Because Not that I get a vote, but I vote for you.
Yes.
Oh, thank you.
I vote too.
Politics is definitely not an area that I've ever considered, but I definitely feel like more people need positivity and more people need to feel that they have power within their own practice to make changes.
Awesome. Amen. Super.
Well,
you answered our usual last
I
question
know
of
you
what you're
answered so
reading.
many. I'll give you the floor to do any closing statements, pieces of advice that you'd love to give, and then we'll go from there.
Yeah, I guess my closing statement would be to not focus on what you don't have or what's not working, is coming up with solutions that benefit everybody. And solutions from the hygienist to the doctor of, hey, if we achieve this, could we maybe find a CE webinar at no cost to educate each other on and become more unified in our thought process? I want everyone to see what I can do for these patients, and there's so much we can do if we have each other's support. From the dentist side of understanding, okay, that sounds great now that I understand it, how are we going to pay for it? And asking the team, hey, who here would be on my side if we said we were going to drop insurance contracts? I feel guilty as a dentist saying to my patients, we're no longer going to accept your check as the payment. Is anyone else behind me? Or do we think that'd be something we could all support if we're going to be doing the right thing? And then all of a sudden realizing that if the whole team's on board behind this vision of where we want to go, you're going to start creating unity. And that's the whole goal. And what we're doing as a practice is to become a family and a team that's providing great care. But it's a hard road. It's a lot of work. It's a lot of frustration, and it's scary. And so the more you hang around other people, the more you talk to people that have been through it before, and it keeps you motivated to make that next step and to keep moving forward, it's going to be all worth it. Because I can't imagine if I hadn't made those changes, what I'd still be doing these days. And the amount of pride, the amount of great feedback, the amount of changes that we're creating for the positive, all these improvements are making me so proud of this team, what we're doing for the profession. And also too, the fact that like we leave here with great days. I want to go home to my family feeling like I really did great today. I had a great day. And my family now knows this is awesome. Dad had a great day at work every day. Obviously you have your ups and downs, but the whole concept is like, how do I recreate my best days? What went well that day? If I could do that every day and repeat it. And that's us 3-2-3. If I had every patient on a maintenance interval that was for their health, and they're doing what they can at home, and I'm helping them, we're working as a team, and we have health, and all of a sudden I feel like I'm winning, and my treatment success is going up. And that gets you motivated to want to stay in dentistry instead of getting burnt out. As a profession, we can so hard get burnout, physically fatigued, mentally fatigued, not to mention the stresses of not even wanting to eat lunch with your team and sitting in the car and getting that stomach feeling on Sundays that you don't want to go to work the next week. I've been there, I've done that, and I don't want to do it anymore. And so instead of sitting back and complaining what's not there, if you're not in an ownership position, it's hard to make a lot of changes. But your attitude about things and your way of trying to approach things in a way to make change is what you can control. And maybe you have to change locations or practices to get what you want. So that's the learning curve as I'm going through life, is finding other people that have been down that path, set your expectations for where you want to go, and don't settle for anything less. This is our job and our profession and our name behind it. Make the best of it. So I think a lot of people forget they have a lot of power and decisions that they can do and what they can do, especially with the internet. If there's things that you are finding are working, put it out there. Let other people join you in that. There's a lot of positivity that's happening, but unfortunately there's a lot more negativity. So you can either choose which way you want to be on, and at that point, you have control and choices, and it makes you feel like you actually are going to go somewhere in this world that you're going to be proud of when you're no longer able to practice and no longer able to do this. You look back at your career and going, wow, I'm really so proud of what I did for my patients. And that's the goal. Treating people well, creating health, and also being proud of what you did.
Awesome.
I
Where
hope that
can
wasn't
people
too
find
long of a,
Love it. No, it's
I'll
fantastic.
edit it.
Yeah.
Just kidding.
yeah.
Where
Yeah.
can people find you, Dr. Edwards?
Through Instagram at 323 Dentistry, and it's spelled out with letters, not numbers. Part of that was to look a little bit more upscale in terms of the name, but also too getting people to really understand it is a individual letter. It's individual pocket measurement. We are hitting each of these points and we're not skipping over. So yeah, Instagram 323. It's the best way to find me. Please follow, comment, give me some advice. So this is my new thing of trying to reach out there. So any feedback of how I can improve or different aspects of a different way hygienists would like to see things. So I'm definitely open to keep evolving this concept and idea. And if there's any dentists out there that are looking to have help, feel free to DM me, Coach, and I'd be happy to help them along this journey of how to create it for themselves.
Awesome. We need coaches like you. This is what I like to do, is raise up everybody in hygiene. So we need doctors like you to raise up the hygiene and the doctors. So high five. Awesome.
Thank you.
Thank you so much for coming today.
Of course. I appreciate it. Thank you for having me.
Yeah.
Great. Thanks for tuning into today's episode of Functional Roots Podcast. Don't forget to subscribe and follow us to stay connected. And if you enjoyed the episode or found it helpful, we'd love for you to share it with a friend.